If you've spent any time digging into the turning points of human civilization, you know that few stories are as dramatic and as overlooked as the rise of modern medicine. Before you and I were born, before the hospitals and antiseptics and vaccines we take for granted, the world was a brutal arena where a simple infection could end a life and epidemics shaped empires. So before we get into the milestones, I want you to picture the sheer scale of the transformation we're about to unpack. In just a couple of centuries, humanity jumped from bloodletting and superstition to organ transplants, germ theory and antibiotics. And that didn't happen smoothly. It happened through centuries of trial, error, resistance and breakthroughs that changed not only how we heal, but how we survive. That's exactly why this topic matters. Not as trivia, but as knowledge every serious history buff and survival-minded person should understand. Because when you know how we got here, you're better equipped to navigate where medicine may be headed next. If you're watching this video and you work in medicine, or you're a history buff who likes to understand how threats evolve and persist over time, pay attention. Diabetes is not just another chronic disease. It's a worldwide shift that began quietly, but is now exploding, especially in regions like ours. From being something doctors saw occasionally, it has become a silent epidemic that kills, blinds, cripples. In the next few minutes, I'll walk you through what diabetes really is, why it matters, how it works, how to catch it early, and most importantly, what you can do to stay ahead of it. Stick around. This knowledge could one day save a life, maybe your own or someone close to you. Now, let's get into it. When someone says diabetes, what they mean is a chronic metabolic disorder in which the body fails to regulate blood glucose properly. Under normal circumstances, when you eat, the food breaks down into glucose, a fuel that cells need to function. The pancreas produces insulin, a hormone that acts like a key allowing glucose into cells. In diabetes, that mechanism breaks down in one of two main ways. Either the pancreas no longer produces enough insulin, or the body's cells become resistant to insulin's effect, or both. The result is glucose accumulates in the bloodstream. Over time, that excess sugar damages blood vessels, nerves, and vital organs. There are different types of diabetes, and each behaves differently. The first is what we call type 1 diabetes. In this form, the immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. The person ends up producing little to no insulin. This type often appears in youth, though it can occur at any age and requires lifelong insulin therapy to survive. Type 2 diabetes is by far the most common, globally and locally. In this form, the body either doesn't produce enough insulin, or the cells stop responding properly to it. It was once considered a disease of adult onset, but nowadays it shows up even in younger people. Lifestyle, diet, body weight and inactivity play huge roles. There's also gestational diabetes, which arises during pregnancy when the body can't meet the increased insulin demand. It often subsides after birth, but raises risk of future diabetes for both mother and child. And then there are lesser-known or secondary forms linked to other medical issues, like damage to the pancreas. Rare but real. Symptoms can vary depending on the type and, well, just how advanced the disease is. In general, people may notice increased thirst, frequent urination, even at night, constant hunger, unexplained weight loss, fatigue, and blurred vision. Cuts or sores may heal slowly, and there can be numbness or tingling in the extremities. Type 1 might strike relatively fast, over weeks or months. Type 2, though, may creep on gradually, often going unnoticed for years. That delay is dangerous. By the time symptoms surface, serious damage may already be underway. Once diabetes sets in, consequences can be severe if left unchecked. Chronic high blood sugar harms both large and small blood vessels, raising the risk of cardiovascular disease, heart attacks, strokes, atherosclerosis. Small vessel damage affects organs like the eyes and kidneys. Some people end up with retinopathy, which can potentially lead to blindness. Others suffer kidney damage, possibly requiring dialysis. Nerves get damaged too. Neuropathy can cause weakness, numbness, pain, especially in the feet and hands. Poor circulation plus nerve damage can lead to foot ulcers, poor healing, even amputations. Beyond that, skin infections, oral health problems, and other complications, even mental health challenges like depression, are more common among people with diabetes. So, if diabetes is this dangerous, how do you fight back? First, detection. Diagnosing diabetes involves simple, relatively cheap blood tests. Methods include a fasting glucose test, a glucose tolerance test 2 hours after a glucose drink, a random blood glucose reading, or measuring average blood sugar over the preceding months via the so-called A1C, or glycohemoglobin test. Once diagnosed, management depends on the type and severity. For type 1, insulin therapy is essential. For type 2, especially early on, non-pharmacological strategies are first line: diet, exercise, weight management. As the disease progresses, oral medications, and sometimes insulin, are added. For lifestyle management, aim for regular moderate physical activity, not exotic gym plans. In many settings, simple daily walking, climbing stairs, staying active works. In fact, in places like Kenya, health guidelines recommend adapting physical activity to local realities and encouraging movement that requires no special equipment. Diet matters. Focus on foods rich in complex carbohydrates, fibre like beans, lentils, whole grains, lean protein, healthy fats, and reduce refined sugars and saturated fats. Maintain a regular meal schedule. For overweight patients, modest weight reduction, even 5 to 10% of body weight, can improve insulin sensitivity and slow disease progression. But controlling blood sugar isn't enough. To prevent long-term harm, you also need to control blood pressure, lipids, that is, cholesterol, and regularly screen for complications, eye exams, kidney function, foot checks. What does this look like in practice for a practitioner or a medically minded individual who also values practical readiness? Suppose you manage a rural clinic or you treat patients in a low-resource setting. You can start by offering routine fasting glucose screening during checkups. Low cost, but high yield. You can counsel patients on daily habits, advise walking instead of waiting for transport, encourage simple dietary swaps, whole grains instead of white rice, beans instead of processed snacks. When a diagnosis is made, even if it isn't severe, implement follow-up plans. Regular monitoring, education about glycemia, explaining the risk of complications. Use community resources, group counselling, peer support, especially when insulin or medications aren't easily available. For patients already on medication, schedule periodic blood pressure and lipid checks, do foot and eye examinations, and refer to specialists in time. Remind patients that diabetes is chronic. Even if sugar levels are under control now, maintaining that control long-term is what preserves sight, kidney and heart health. From a broader perspective, for a health system strategist or a clinician interested in population health, recognize that diabetes, especially type 2, is preventable in many cases. Primary prevention is powerful. With healthy eating, regular exercise, avoidance of tobacco and weight control, the onset of type 2 can often be delayed or prevented. This is critical in regions like Kenya, where many people get diagnosed only when complications are advanced. In short, diabetes is not inevitable, but once it takes root, it demands vigilance, commitment and consistent care. For someone serious about health, history, survival readiness, mastering the biology, the risks, the prevention strategies is a form of preparedness. You are not just defending one person's health, you are defending families, communities, future generations. If you found this guide useful and believe it could help others, do the right thing, subscribe, share with friends, colleagues, family. Help spread knowledge that is simple, practical, and can turn the tide against a rising global scourge. Keep learning, stay sharp, and let's stay ahead.